Imagine this. You're walking through a forest 50,000 years ago. Your throat burns, your head pounds, your body is on fire. There is no pharmacy, no hospital, no Tylenol. You are completely alone with your pain. But here's the truth. Ancient humans didn't just survive this, they decoded it. They understood something we have forgotten. Disease was not an enemy. It was a signal. How did a species without microscopes battle invisible enemies? The common explanation is simple. They died. Most of them anyway. If you got an infection, you were gone. That story is incomplete. In 1991, hikers in the Alps found Ötzi the Iceman, a frozen mummy from 5,300 years ago. Scientists analyzed every cell. Here's the twist. Ötzi was sick. He had arthritis, a parasite in his gut, but in his leather pouch, 2 pieces of birch fungus. For decades, we thought this was just fire starter, but a 2012 study proved otherwise. That fungus was a prehistoric antibiotic. Ötzi didn't know about bacteria, but he knew one thing: bitter plants stop pain. So how did they learn? The answer is terrifying. It was the sick person themselves. You feel bad, you chew a leaf, you feel better, you remember, you die, you don't. Evolution is a brutal teacher, but there's a deeper layer. In 2015, anthropologist Dr. Karen Hardy studied Neanderthal teeth. Fossilized plaque contained traces of willow bark. That is the main ingredient in aspirin. Imagine that. 50,000 years before your local pharmacy existed, humans were already using aspirin. Why bitter plants? Because ancient brains learned a trick. Bitter equals medicine. Sickness didn't just cause pain, it made the brain search for bitter things. But here's the first major twist. They didn't just treat the body, they treated the story. To ancient humans, there was no difference between a virus and a curse. In 1971, anthropologist Claude Lévi-Strauss studied Amazonian tribes. A sick person doesn't say, "I have a fever." They say, "Someone shot a poison dart into my soul." This isn't stupidity, it's a different operating system. The placebo effect proves this. In 2014, Harvard's Ted Kapchuk found that even when patients knew they were taking fake pills, their symptoms improved if the ritual was convincing. The shaman wasn't just dancing, he was hacking the patient's brain, and we have the modern data to prove he was right. The shaking of a rattle, the painting of a face, these actions released endorphins, the body's natural morphine. But sometimes the medicine wasn't a plant or a dance. Sometimes it was much more radical. They went inside the body. Trepanation, drilling a hole in the skull. We have found Stone Age skulls with healed edges. People survived this for hours, no anesthesia. Why? The common explanation: to let evil spirits out. But look closer. A 2019 study analyzed 150 drilled skulls. Many patients had chronic migraines or head trauma before the surgery. The twist: drilling a hole physically lets the pressure subside. The literal squeezing of the brain, it works. These ancient barbers didn't understand blood pressure, but they noticed that when you drill a hole, the screaming stopped. Did ancient humans understand contagion? Did they run from a coughing person? For a long time, anthropologists said no. Germs were invisible, so they ignored them. Then came the leprosy study. In 2020, a team examined medieval skeletons. Lepers were buried outside town walls, not as punishment, as quarantine. And this behavior appears much earlier. The Book of Leviticus, written 2,500 years ago, says, "He shall dwell alone." But this wasn't just about rules, it was about something deeper in our DNA. You don't need a microscope to feel disgust. Disgust makes you recoil from mucus, from pus, from rot. Psychologist Paul Rosen calls disgust the body's behavioral immune system. Ancient humans didn't know about bacteria, but they followed the feeling of ick, and that feeling saved their tribe. We've seen their pills, we've seen their surgeries, but their most powerful medicine wasn't something you could find in a pouch or a drill. It's something science still struggles to explain today. In 2008, a team in Ethiopia found a skeleton from 1.5 million years ago. This creature had a massive jaw tumor. It would have hurt to eat. It would have smelled. They should have been abandoned, but they lived for years. The bone showed healing. Someone fed this sick person, carried them, sat with their stench. Why? No evolutionary benefit, no medicine. This is the part we can't explain with science. Ancient humans did something illogical. They were kind. Anthropologists Anthropologist Margaret Mead was once asked, "What is the earliest sign of civilization?" Not a tool, not a fire. She said, "A healed femur." A broken leg that is healed means someone stayed with the fallen one, bound the wound, carried them to safety. Sickness invented medicine, but it also invented compassion. We think we're smarter today because we have antibiotics and MRIs, but go into a hospital room. Watch a nurse hold a stranger's hand. Watch a parent wipe a child's forehead. That ritual is 100,000 years old. So the next time you have a fever, ask yourself, you're not just a sick animal, you are part of a 100,000-year-old story, a story where humans decided not to run from the sufferer, but to sit down beside them. We still don't know exactly why we do that. The mystery remains, and maybe that's the real medicine.